Family therapy, also referred to as couple and family therapy and family systems therapy, is a branch of psychotherapy that works with families and couples in intimate relationships to nurture change and development. It tends to view change in terms of the systems of interaction between family members. It emphasizes family relationships as an important factor in psychological health. Family therapy uses a range of counseling and other techniques including communication theory, media and communication psychology, psychoeducation, psychotherapy, relationship education, systemic coaching, systems theory, reality therapy. Communication therapy calls upon the expertise of various authorities well versed in integrated therapy. They explain fully the state-of-the-art practices for all therapy areas, from global areas in communication therapy, to technology for oral rehabilitation, auditory skills, speech reading, speech and voice, pronunciation, and language skills, and telephone communication training. Case studies demonstrate the effectiveness of the integrated approach, making this book a significant advancement in communication therapy. Media and communication psychology seeks an understanding of how people perceive, interpret, use, and respond to a media-rich world. In doing so, media psychologists can identify potential benefits and problems and promote the development of positive media. Psychoeducation refers to the education offered to people who live with a psychological disturbance. Frequently, psychoeducational training involves patients with schizophrenia, clinical depression, anxiety disorders, psychotic illnesses, eating disorders, and personality disorders, as well as patient training courses in the context of the treatment of physical illnesses. Family members are also included. A goal is for the patient to understand and be better able to deal with the presented illness. Also, the patient's own strengths, resources and coping skills are reinforced, in order to avoid relapse and contribute to their own health and wellness on a long-term basis. The theory is, with better knowledge the patient has of their illness, the better the patient can live with their condition. Psychotherapy, or personal counseling with a psychotherapist, is an intentional interpersonal relationship used by trained psychotherapists to aid a client or patient in problems of living. It aims to increase the individual's sense of their own well-being. Psychotherapists employ a range of techniques based on experiential relationship building, dialogue, communication and behavior change that are designed to improve the mental health of a client or patient, or to improve group relationships. Relationship education presents and promotes the principles and practices of premarital education, relationship resources, relationship restoration, relationship maintenance, and research-based marriage preparation. Systemic therapy is a school of psychology which seeks to address people not on an individual level, as had been the focus of earlier forms of therapy, but as people in relationship, dealing with the interactions of groups and their interactional patterns and dynamics. Systems theory is the transdisciplinary study of systems in general, with the goal of elucidating principles that can be applied to all types of systems in all fields of research. Reality therapy is an approach to psychotherapy and counseling. It was developed by the psychiatrist Dr. William Blair in 1965. Reality therapy is considered a cognitive behavioral approach to treatment. The reality therapy approach to counseling and problem-solving focuses on the here and now of the client and how to create a better future. Typically, clients seek to discover what they really want and whether what they are currently doing, how they are choosing to behave, is actually bringing them nearer to, or further away from, that goal.